eye complications from diabetes actually are the leading cause of visual loss in most developed countries of the world, including the United States. And as innovators, we've been looking at both bringing new treatments to patients with diabetic eye disease to prevent the visual loss in better and more effective ways, and also in being able to identify the patients who are at risk of visual loss or who have eye disease that don't know it yet, and then getting those into early care. Because with early care, we can dramatically reduce the amount of vision loss that occurs from this disorder. Well, the Joslin Vision Network concept was the ability to image a person's eyes wherever they may be, whether or not they're in a hospital or academic institution, or whether or not they have a highly qualified ophthalmologist there. So our ability with these devices and this approach was to innovate a way to image these eyes without dilating them and to send the images to where they could be expert read, and we could then determine what care was needed for the patients. Utilizing this technique, we've evaluated people in many different settings. In remote areas, this is probably the most important because these are the folks that have the hardest ability to find good medical care, let alone specialized eye care related to diabetes. So with this simple test, by simply moving the equipment to them and then being able to evaluate the eyes, we can detect these individuals and arrange whatever special transportation or needs are required to bring them the treatment that they need. Since the beginnings of the Joslin Vision Network, we've now imaged over 2 million eyes. And we found that about 1/3 of the patients have eye disease that could result in loss of vision. And so these are patients that have immediately benefited from that technology. In addition, even those that have not had that severe eye disease as of yet receive additional education, knowledge about their eye condition, and get put into appropriate care. So in fact, we've probably reduced the vision loss that's accrued to these patients over time as well. Moving in this direction is incredibly important. It's estimated that there'll be over 450 million people worldwide that will have diabetes by the year 2030. Even if we were to just evaluate these people once a year, and many people need to be evaluated more than once a year, but just to evaluate them once a year, that's about 23 eyes every second, 24 hours a day for the entire year. And so we obviously cannot do that in person, and we clearly can't do that in underserved areas in person. And so this type of innovation allows us the capability of reaching that magnitude of people and providing the eye care that otherwise would just go missing. One of the things to remember is that the majority of visual loss occurs to people who are in the working age group. And because of that, when they lose their vision, there's a tremendous loss of productivity and a tremendous cost to the government and society to maintain these individuals. It's tens to hundreds of millions of dollars a year that are saved by this type of approach.